Yellow fever is caused by a virus transmitted to man by species of mosquitoes as a Aedes aegypti from infected monkeys, and the disease is not spread from person to person. Classical yellow fever is usually fatal. After the onset of symptoms, there is a brief remission of 2 to 24 hours, following which the symptoms may recur with the development of epigastric pain, jaundice, renal insufficiency, cardiovascular instability, and also bleeding from various sites, for example, the gums and needle puncture sites. Yellow fever vaccination is protective against the disease and needs to be repeated every 10 years. Okay, so all cases of yellow fever should be reported to the appropriate disease control officers. So the main cause is the yellow fever virus, and the symptoms are fever, muscle pain, and particularly backache, headache, shivering, loss of appetite, nausea or vomiting, and also diarrhea. And the signs that are usually elicited are congestion of the conjunctiva, jaundice, bleeding from various sites, as petechiae, ecchymosis, among others, and also right upper abdominal quadrant tenderness and signs of renal failure. Investigations are urinalysis, where there will be proteinuria and also raise urobilinogen levels, also LFTs as liver function test, and blood urea electrolytes and creatinine, blood sample for yellow fever virus serology. Okay. So the treatment objectives are to provide supportive care for hepatic, renal, and circulatory failure, and also to manage bleeding disorders. Non-pharmacological treatment: if the yellow fever is suspected in a patient, admit immediately to an isolation ward, and full supportive treatment for hepatic failure and acute renal failure. So pharmacological treatment: antiviral therapy. There's no specific treatment, and for bleeding patients, you can give fresh frozen plasma. Referral criteria: so refer to a hospital, preferably one with an isolation unit.